for the call to the public, Guy Hubbard.
Oh, is that already?
Did you wanna wait till the end? I know you mentioned.
No,
possibly.
I think I'll do it now.
Okay, 3 minutes.
Okay, I'll talk quick. We have some questions about the 911 board. And one would be that right now, these elected official large position still shows vacant on the website. And there's been updates since then. We wondered who that person might be, or if you're gonna put that out, or if it's gonna continue to be Ms. Garber. And the other position would be citizen at large was Mr. McMaster, but now that he's county commissioner. Thought that would, I think, I'll just speak for myself, that should be a citizen, and rather than a county commissioner or any elected official for that matter. But wondered where that was at, and if that was something that was going to be discussed later. Other than that, that's all I have.
Thank you so much.
Mhm.
Appreciate that.
Can I ask a question real quick?
Sure.
Do you have any names that you want to submit, or whether now, or do you want to give them to us?
I do know that Mike Ash has expressed an interest in the past. I believe he sent in a letter of interest before, when I'm not sure if it was when you were appointed or before that, previous to that. And he is still interested in being appointed to the 911 board, representing the citizen at large. And I would say that his experience, he was a deputy for the county for, I don't even know how many years, 20, 30 probably. And then he was also the director of 911 for a few years. So, no, he definitely has a good background.
All right, thank you. All right, moving on with our agenda. Agenda item 4. Consider authorizing district court to hire a deputy court clerk at salary grade 3, $13.90 to $18.06 an hour, starting $13.90 to $14.94 to fill a vacancy.
I'll make that motion.
Or,
Any discussion?
Diane
You certainly may, Judge.
Enlow is leaving. She's our longest serving employee. She has a fair amount of vacation saved up. She has some sick time saved up. And she is going to have some ear surgery. I don't know if you're aware, she's someone who has some hearing issues. And she's been cleared to Blue Cross to have some hearing issues. The last day she'll actually work will probably be June 7th. She'll be on the payroll till the middle of August. And she does the most complicated work that we have. And we have the money in our budget to put the new person on as soon as we can get them hired, and we'd like to do that. We're gonna be hurt. We have to wait till the middle of August to replace her. So we've saved up some money when we didn't replace a clerk for 7 weeks earlier. We'll be replacing Diane at a lower pay rate. There's enough money in the budget to. At this point, we've advertised it, and we probably couldn't get anybody hired in the middle of June anyway at this point, but just, we'd appreciate it if we do it as soon as possible.
Thank you so much. Any other comments or discussion based on that input? All in favor of advancing this to Wednesday night's agenda, say aye.
Aye.
Any opposed? All right, thank you. Agenda item 5. Consider approving up to $5,000 for additional analysis of 911 MERS funding by Yo and Yo, and authorize the central dispatch director to sign all necessary documents. The board approved up to $20,000 for this purpose on August 16, 2018, and then an initial contract of $8,500 on February 7, 2019.
so moved.
Support.
Any discussion?
Madam Chair?
Yes.
I did not attend the last 911 meeting, it was a couple weeks ago, because I wasn't sure legally if I could be there in attendance or not on the board. Can we get an update from Guy or any commissioners that were there, what the status of this is? Cindy?
Yeah, I'd be glad to. And actually, I wish Butch was here, as he had some comments on this agenda item. He had some concerns, really. I don't think we got $8,500 worth of audit information. I think Mike and Angie did most of the work, and we paid them $8,500 for not much, and to give them another $5,000. I'm not in favor of it. I think we can do that in-house for $0.
Angela's here, do you wanna comment on that?
I guess, my concerns were, because the board has already invested this money into it, I was feeling that you would probably want some kind of a report or something afterwards, so for audits in the future, whatever we come across, at least we'd have documentation on how we corrected the issue. I mean, it really doesn't, I didn't know what you needed, I guess, to move forward to get this resolved, so.
So, you're saying that you feel like maybe moving forward with Yo and Yo will at least give us a complete report if there's an audit in the future, that they started the job and they finished the job, even though it sounds like you are supplementing their work, is that correct?
Trying to save money. I've been working with Lindsay Stevens, who is a state analysis as well. And she's also helped put some time into this too, to help us come up with a number. So, I mean, I do understand where they're coming from. I know he traveled here a few times to meet with myself and Mike, so I know that added up. But I guess I just wasn't sure what we needed to move on to get this resolved, because it's been a long process. We've been working on it for about a year now, so. So any input or recommendation, I'm definitely open to.
And Lindsay from the state was fine with what we had done so far, correct?
Right, correct. She helped create part of that spreadsheet that we went over.
Did she actually ask for additional information, or is this more for us?
She asked for the years, our salary for 2014, 15, and 16, and she just wanted to look at that to make sure that those years were showing the same consistencies, that there was no issues, and she found that it had. So she didn't feel like it was necessary to go back any farther. She was seeing that what we were paying seemed appropriate. So the state was no longer concerned with prior to 2017, if that makes sense. So the issue really we're finding is only within 2017 and 2018, where that 3 times multiplier took place.
So if she's satisfied at the state, we're not satisfied here, is that?
They're satisfied. I guess I'm looking to see what you guys would be satisfied with. I guess, I could speak with her and see if she'd be willing to come over here and give a presentation on how she came up with her numbers.
So what specifically is the $5,000 for?
To wrap it up, he said that should be more than enough, but I don't know what the number is I don't know what the final bill would be, but he said he was going to go over the numbers that we had come up with so far, basically to put his stamp of approval on it, and write a report, and come present to the 911 board and the board of commissioners with the findings.
Mr. Harrington, do you have anything to add, or any additional insight or thoughts about it?
Well, I know at the meeting, I was there for that, I'm not on the board, but the meeting prior to that, they had asked for 2013, 14, 15, and I think they got information originally for 2016, 17, and 18. And I agree with Angie that this all happened 2017, 2018. That's when there was a penalty phase put in, and our then finance director essentially arbitrarily just set up a figure that was incorrectly based on the nomenclatures of the divisions that led you to believe that there were, in fact, one of them clearly said central dispatch only, when in fact it wasn't anything close to that, and resulted in what I would call a definite overassessment. The only real issue is how much it was. And, depending on where it came in is where I'd be comfortable with. It doesn't sound like that far off. But that's, I don't know that going to 2013, 14, 15 is going to add anything to the analysis.
And is that what they're asking for the additional $5,000 for? That's what I'm trying to understand, is what the additional
$5,000, he said, he's approaching the original $8,500. I think he had like $600 and some left. So he needed the additional funds to complete the report, double check the spreadsheet, make sure that we're all on the same page where the numbers came He'd write the report, and then he would come to the 911 board meeting and here to the Board of Commissioners meeting and present the findings.
I have two thoughts about all of that. One is that at one point, we did approve up to 20,000. So even with this additional expenditure, we're a long ways away from 20,000.
Right.
Secondly, because of the nature of it, I feel a little uncomfortable with the work being completed internally because it feels to me like an audit of funds that have been moved around internally should be completed by an external audit. So that, like you said, for future, you know, whether we're getting the right bang for our buck, I don't know, but we can't start over with another external audit firm at this point. So, I don't know what other thoughts are at the table on that.
I'm sure I thought, if we approved up to 20,000, I'm having trouble understanding why we're here even voting on this again.
Because we accepted a proposal for 8,500 that was not going to exceed, it was gonna be 8,500. That's why they went with Yo and Yo, because it was gonna be so much cheaper.
And now
And at
they want,
8,500, they were gonna have this whole
they
thing
want
done
another
for us.
5,000 to give us a.
They want another
report.
5,000 because they seen that the board approved 20, so they'll still be under 20, so they might as well charge again. That's what it is.
It's exactly what it is.
Yes.
Can we also hear from the director, and Kay Nichols also sits on the board? If either of you would like to, if we could.
My opinion, and again, it's personal opinion, is that I believe that the county commissioners are gonna be able to accept the audit independently from Yo and Yo rather than internally. Because then we know it's outside, completely 100% outside audit. If you were asked by your constituents, who did this, who did this, who did this, then it's just a done deal. Here's what they did. They were completely unbiased. I don't even know if they knew that the board approved 20,000. And then they could easily look it up if they didn't know that before. But I don't recall what the other bids were, but the other bids were significantly higher than 8,500. And he told us then, he said, when I get close to 8,500, I'll let you know, we may go over. And there were, at the time the bid came in, it was, we didn't know exactly how far back it was gonna go. We had I think the bid set for 4 years, 5 years, something like that. If we go all the way back to 1996 when the trouble started, which we're not going to, the state is happy with feeling that back in 2014, it was this number, 15 was this number, then since they're consistent, she's okay with going on from there. And the state is the one we really had to make happy. That's the one we were really mostly worried about because they pay a lot of money to the 911 board, or to 911. So my opinion is that I think it would be easier for the county commissioners to accept an outside independent audit completely done. They'll come and make a presentation so that it's easily understood. And then, again, making your constituents happy that it was done independently, not internally. Angie and Lindsay from the state have done a lot of work. There's no doubt about that. But I believe that without that, we would have spent the 8,500 a long time ago. And going into it, he really didn't know what he had to do. He didn't know how much information he was going to get from the county and how timely that would be. And I think there were some delays, but again, he wasn't working on it constantly. When he got the stuff, he worked on it. So I know it's by the hour. So that's just my opinion.
I too agree with Guy. If we have an independent final audit, takes care of transparency, which I really feel is important.
I guess my question would be then, is the 911 board gonna do their own audit separate of the counties moving forward? From here on out?
I know one thing that we've requested from the county commissioners is that all of the wages for the dispatchers, the percentages that are necessary to be removed from the county, the county's contribution percentage-wise for the 911 dispatchers, if we can be made aware of those numbers, then I don't believe that's necessary personally. Because the county's done audits for years and years and years, and this was missed by your auditors, which I can understand. They didn't know any better. But if we can get that information every month, Angie can look it over. We don't need to know names. We just need the total wages for 911 and then the percentage that we're responsible for. And we'll be able to do the math ourselves, or Angie will. So no, my opinion is no. We would not need an independent audit every year.
And this is not a standard audit. I mean, this is
No, it's not even close.
not even
It's
close.
just MERS.
Okay,
I simply feel that, in my opinion, for 5,000 extra dollars or maybe less, to keep that transparency lens up, I feel like that's worth it for that expenditure to me. Just because I don't want to hear other people say, well, we did, at the 12th hour, we changed something at the last second. It does look, even though we're not, it doesn't have the appearance of above board, and $5,000 to make people feel comfortable to me is worth it, even if it is a waste.
all right, all in favor of moving this item forward to the Wednesday night committee of the whole, say aye.
Aye.
All opposed? All right. Moves forward to Wednesday night. Agenda item 6. Consider the reappointment of Wilma Bowen, a Democrat, to Shiawassee County Jury Board for a new 6-year term as recommended by 35th Circuit Court Judge Matthew J. Stewart in accordance with MCL 600.1301.
So moved.
Support.
Judge Stewart did submit a letter supporting this nomination. It's in our packet. Any discussion on this item? All in favor of moving this forward to Wednesday night, say aye.
Aye.
Any opposed? We move item 6 forward to Wednesday. Item 7. Consider adopting resolution number 19-05-06, approving and requesting MERS to rename MERS divisions 19 and 20 so as to clarify they do not contain any 911 central dispatch active or retired personnel.
So moved.
Support.
Any discussion? Any input from our 911? All in favor of advancing this to Wednesday's agenda, say aye.
Aye.
Any opposed? Item 7 advances. Are there other agenda items? Any additional individuals wishing to address this committee? All right, is there a motion to adjourn?
So moved.
All right,
Just, yeah.
we're adjourned.
This meeting of the May 14th Health and Human Services meeting to order. Let's stand for the pledge, please. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Anyone for our first call to the public? Anybody? No? All right, seeing none, we'll move on to agenda item number 4. Consider accepting and placing on file the 2018 Health Department Annual Report. Larry Johnson, Health Director, will present this report. Larry.
I've been asked to be brief, so I'll be brief.
All right, thank you.
I think, I handed out the report. The health board members have already seen it. I think the report turned out real nice. Just the highlights are on the inside cover. What a year! What a year it's been. You know, obviously we've completed the addition to the Capitan Center with your support. But more importantly, we've started new programs for our public. The health clinic, the health education program. These are all big, huge initiatives that came out of our strategic plan. We want to keep the momentum going, and this is because of the efforts of the staff that work there. They're top notch, and you know, we can't have a department without good people. So, and I couldn't be there without them. So, here's the results of their work. I hope you take time to look it over, share it out. It is on our website. And you all have electronic copies, but I don't print a lot of hard copies, but enough for the boards and anyone interested in having one. So, thank you for your support.
Can you email all the board members those commercials that the three of us saw the other day,
Yes.
please?
Yeah, we have created some videos on the health department using hepatitis A funding, mostly related to the hepatitis A outbreak that we've been dealing with, but also one just for the health clinic, the county health department. Jordan Sovis, local guy, does these videos. He's done stuff for some of the other, just really does great work. He actually filmed in our facility, so they're pretty neat, and I would be happy to share those with the board, and I will do that.
Yeah, we're quite tickled about the one, no rabies.
Yeah, that's
So, you know, like keeping
I
that
like
number
the-
low.
I like the photos on page 16, bottom, page 16.
Chairman, Garber, I didn't get a motion or a second
For
this.
This,
Well, I will make a motion to consider accepting it, putting it on file.
Thanks.
Thank you, Larry.
thing.
All in favor of accepting Larry's 2018 Health Department Annual Report, signify by saying aye.
Aye.
Thank you. Anything else on this? Moving on to number 5, consider authorizing the Health Department to contract with Shiawassee Regional Education Service District for social work services in the maternal infant health program in the amount of $67,000 for the period of 7/1/19 to 6/30/20, and authorize the health director to sign all necessary documents.
I'll make the motion.
Second.
All right, any discussion?
This is just a contract renewal with the RASD for our social worker that does the in-home maternal and infant health program. It is for the same amount as the previous year, so we kept it flat. Questions?
Anybody else? All right, all in favor signify by saying aye.
Aye.
Motion approved. On to number 6, consider authorizing the health department to contract with Great Lakes Commission for the river cleanup grant in the amount of $6,473.75 for the period of 4/22/19 through 9/9/19, and authorize the health director to sign all necessary documents.
So moved.
Support.
Discussion.
The river cleanup grant for the 12th straight year. I say that it's unprecedented every year. We keep getting it. It's awesome. Huge community event. We did have some of you out there last year. That was exciting. We'd like to see you back this year. We had Commissioner McMaster, Commissioner Marks, and Commissioner Root were out there last year, putting in some hard hours in that river. So that would be July 27th. There will be multiple sites, but Corunna is tying it into their sesquicentennial this year. So the Corunna site we expect to be busier. Owasso is the usual site at the Oakwood Bridge by the Kiwanis Ball Fields, and Vernon has a crew this year. So they will be also doing a collection, cleanup in Vernon. So,
Participation from the village, Byron?
Nobody litters in
No one.
but we do get support from some
Not allowed down
businesses
there.
in Byron. Chef's Canoe and Matador's Pizza
They usually
supported.
do theirs on, when is this?
July 27th.
Yeah, they do it earlier because they do it for our fireworks and that they have in town, so they do a little bit, clean the river and everything.
And you have some famous.
Probably at the
persons
end
from
of
this.
June, they do theirs.
Car drivers.
Continue.
Thanks.
All right, any further discussions on this? All right, all those in favor of this, signify by saying aye.
Aye.
Thank you. Number 7, consider an appointment to the Shiawassee County Mental Health Authority Board, Shiawassee Health and Wellness. The Health Authority Board recommends the appointment of Rick Lindell for a 3-year term.
I'll make this motion.
Second.
All right, any discussion?
Yeah, I was on the nominating committee and we had interviews and that's who we picked. And then it went to the full board and the full board passed it, so just went through 2 committees.
Okay, thank you.
And I'm on both the full board and the nominating board, so. He seems like a pretty good guy, so.
All right, Gary's happy, I'm happy. Any other discussion? All right, all in favor signify by saying aye.
Aye.
Motion carried. Any other agenda items to come before this committee?
I just want to thank Director Johnson for all the hard work. This is great, another year. And I know you say you got one of the best teams, I know you do. But these kind of things also don't get done if we don't have one of the best directors in Mid-Michigan for our health department. So thanks for all you do, man. You're good at it, we know it. That's it.
All right,
I
any
do.
other?
I have one thing, should have brought up at finance yesterday, it's the health, or the human resource. We were initially going to send our 3 individuals, now we're down to 2. But the conference is May the 20th in Flint. It's an all-day thing to send the 2 ladies that work in our finance office. This is just kind of an introductory to HR and taking on HR responsibilities. It gives them kind of the laws and understanding, just kind of a brief. I don't think it'll be brief, it's an all-day event, but it'll kind of, be introductory for them at least to get them familiar with what we're kind of going to be requesting out of them in the future. So it's $150 or $49 a person. We'll be sending 2 people, so I just want to make sure that we don't really have to do it today. We'll probably just add it to the agenda tomorrow, committee of the whole, but I want everybody to be aware. I should have had this on finance yesterday and I forgot. And there's a little packet that if
Yeah.
anybody wants to see it, that has what's going to be offered in the course, and I think it'll be beneficial.
We'll forgive you.
Okay, thanks. That's all I have.
All right, Gary's happy, I'm happy. Any other agenda items? All right, for a call to the public, Les, step up to the plate.
How you doing? And I'm not sure how to approach this, as I don't want to tick anybody off, which is hard to do in this building. But it was suggested last month at the VA meeting by somebody that was gruff and hard to deal with, but we won't talk about that.
Take that as a compliment, thank you.
Thank you. Anyway, it was suggested that we do a, what the heck was the term?
Proposal or a plan or submit
Yes.
something.
Yes, a proposal, this is on the homeless veterans situation. About, what we're asking for is approval to use some county property which is out by the detention center. There was 26 acres out there, county owned. Zoning is by the city of Corona. You put a building of some sort, some kind of a vehicle maintenance facility or something out there, big pole barn, okay? The trailers, which is tiny homes on wheels, don't need anything but a place to park. The ones that we are building do not need water, do not need sewer, do not need electrical, don't need anything. It's
I don't know if we
equivalent-
want the health director to hear that. Your time is winding down, so.
Well, as is, these are utility trailers that have a tiny home built onto them. Might be something that's like a one room to a couple, 3, 4 rooms. It all depends on how long the trailers are that we have. Matt and I and some other vets own easily 24 trailers, various sizes, that we are giving to the veterans. We are also came up with a bunch of building materials, insulation, you name it, and we're going to build these houses. We look at it as helping veterans that are on hard times. They're homeless. The VA cannot do anything to help them because they are homeless. To get anything from the VA, you have to prove that you're a resident of the county, which defeats the whole idea of them being homeless. They don't have an address. By giving them a place to live, now they have an address.
All right, can you wrap it up, please?
Yes, I can. I was planning on coming back tomorrow, and I will be, and I'll have more things to show you.
All right, thank
Okay,
you.
and carry on then. All right?
All right, thank you.
Give him sweet pills, lump of sugar or something. Or just a couple of lumps.
Okay, thank you. Anyone else? Final call to the public. All right, this meeting is adjourned.
I'm missing something.